I work for a very large company that manufactures things. We make a lot of stuff, we provide a lot of services, and we do it in a really interesting category that has a strong social context. And for me, that's very important. And so what we try to do here, not what we try to do, what we do here is to take technology and put it into a form that people can use. We like to start with the unmet needs of our customers, of our users, and ladder that then to what the big idea is, rather than starting with the big idea first. We have a sort of a carefully constructed philosophy around how we design, and we call it the magic of science and empathy. And what that means is we work very hard to connect the functional features of a product with the emotional benefits we want not only, in our case, patients to have, but also clinical staff, repair people, maintenance people, etc., physicians as well. So we work very hard to try to make those connections and not just be about, in the trade we call it skinning and shipping the product, but rather really think about it as part of the human system, and it's going to deliver a rich experience. Design's relationship with manufacturing, it's inextricably linked. There can't be a separation. And in fact, it's not limited to manufacturing. If we don't do our work in concert with what I like to call our brothers and sisters in the other disciplines, if we're not in lockstep with our colleagues in engineering, all the disciplines of engineering, in marketing, in the sales organization, with the finance people, we're not going to hit any of our targets. We're all going to be walking around blindly. We're going to be throwing the work over the wall when we're done with it, and the outcome isn't going to be as competitive as it could be. So we want to make sure that anything we design is infinitely manufacturable, that it's done in a way that's highly efficient, that we can help take the complexity out of manufacturing, and more importantly, when the product is shipped, that the people who have to use it, who have to repair it, maintain it, have an easier time. We actually have a pretty large global team in 5 countries around the world. Our largest team is here in the US in Waukesha. We also have a team in Shanghai in China, in Bangalore in India, outside of Tokyo, Japan, and outside of Paris in France. And so we have, there's 41 of us, and we're not all one flavor. We're not all just industrial designers of products. We also have people on our team who have MBAs, who have social anthropology degrees, cognitive psychology. They do human factors engineering, ergonomics kinds of things. We have what are called interaction designers. That experience you might have when you look at a computer screen, or you're looking at the dashboard of your car and you're wondering, how do I make this work? We have people who think about that. You know, a cultural question is a good one to ask here because it's not all the same. We can't design for one market and imagine that it's going to work everywhere. For example, in emerging markets like China and India and in Latin America, in Russia, in Central Europe, the needs are different. That doesn't mean we want to dumb down the technology and give them something that's 5 years old, but what we want to do is look at what their unmet needs are, what the criteria are, where they are with their healthcare system, and try to create products that meet those needs, that do, you know, every bit as good, have every bit as good an outcome as you might find at the Mayo Clinic, if you will, but more address the specific needs of those environments. Our philosophy at GE and GE Healthcare has to do with what we call the concept of healthy imagination. And that's about improving the quality and the access and reducing the cost of healthcare. So everything we do in design, everything we do in the company passes through those 3 filters: quality, access, and care. And we call that healthy imagination. And it really helps to guide us towards looking at the unmet needs. We can't just create technology for its own sake through those filters. It doesn't work. In fact, the business leaders won't let you get away with it. So in a way, it's almost self-selecting. And they're really wonderful, powerful tools to use when you get into debates about why you've done something, the choices that you've made. What we want to do is differentiate GE Healthcare products in the market by having really terrific end-to-end experiences, human experiences. We can't forget that as high-tech as this stuff is, human beings have to use it. So we use the way we think as designers, and certainly in collaboration with our colleagues in the other disciplines, to try to bring these richer user human experiences into the product design. So it is a rather complex ecosystem. What we want to try to do is reduce what we call the anxiety journey in medical experiences and make it a little bit more demystified for you. Make it a little bit more humane. Put it more in the context of the rest of your life. Just because you go to the doctor doesn't mean you're still not in your ordinary life. Why does it have to be so foreboding? So we try to think about that. The profession is really changing. I mean, traditionally it was sort of the design of a shiny object, and it's out there, and you certainly see it in the retail environment. There's a lot of design stuff. Some of it you need, a lot of it you don't need. Smart marketeers make a case for why you do need it. I would say that what's been added to design in the last 20 years especially is that we're practicing in the context of business now. We understand that if we don't begin with the unmet need of the user, of the customer, we're going to miss. We're not going to differentiate ourselves in the same way as we could, or perhaps one of our competitors will out ahead of us. You can't only compete on price anymore. Anybody can sell boxes, anybody can make great technology, anybody can fight the war on price. What we can deliver in GE Healthcare is a great experience for the patient, for the clinicians, for our customers who have to support these products and services that we provide. The way we work is in a very cross-functional environment. And the best work certainly I've ever gotten to do in my career is in those cases where from day one in any project, a lot of disciplines were there. They're inextricably linked. So we'll work with engineers, we'll work with marketing, we'll work with finance, we'll work with human resources. We have to staff these things. We'll work with people in manufacturing, in sales. The sales folks need to understand the story the product is about to tell as we designed it, just as we need to understand what their environment is in terms of how they have to convey this information to the customer. A guy like me, when I close my eyes, I tend to see pictures of things. I visualize ideas and concepts, even sometimes business concepts. And I use those techniques of seeing in order to do my work. So when I was a student in school, what they taught me how to do on the art side was to see. And then frankly, that got translated for me in my major as industrial design into this notion of how do I create physical products? How do I use the way I think to craft new ideas for services, etc. When we think about who we want to hire and are they prepared for practice, have the schools prepared them for practice, there's a couple things that I think about. First of all, they're trained classically if they're trained classically in design, art is only one part of the equation. They have to show up as business people in the context of their discipline. If you talk to somebody in marketing or finance, they say, well, I'm a business person and I happen to be in marketing. Designers haven't always done a good job of doing that, and the schools haven't done a great job preparing designers to think that way. So we're starting to see a much more influence of that. I get invited over to MyEd frequently to talk to professional practices classes, to tell the students, you know, what they should anticipate. We don't work in an island. We work very cross-functionally. We work with all kinds of disciplines. There's 7, 8, 9 disciplines in the company with whom we work. And so that's one thing. The other thing is that the students have to be prepared to understand that they don't start with ideas. It's real easy to start drawing. We do it, engineers do it, everybody does it. The fundamental is to kind of hold that back and first go try to figure out what the unmet needs are you're trying to solve for. That leads you to the idea. That translation of that leads you to the idea. When we talk about the challenges of recruiting people to come to Milwaukee, you know, if you're working in healthcare, it's a calling. And if you're going to be a designer, we can all design toaster ovens. How often do you get the chance to change people's lives? How often do you get the opportunity to do something that really meaningfully impacts the world? And we work on projects all around the world. In fact, I think we work with teams in 17 locations around the planet. And so we influence emerging markets in places like China and India, as we do in the US and Japan and Europe. So, you know, while, yeah, maybe the landscape is a little bit more compelling in New York or LA or Shanghai or Tokyo, but fundamentally, if somebody really understands as a practitioner what it is we're doing, they're not as concerned about that. And never mind, Milwaukee's a cool place. My wife and I love living here. It's got some edge. There's a great design school here in the Milwaukee Institute of Art and Design. UW Stout has a great program. We have people who aren't designers on our team, and a lot of the universities, UW-Madison, Marquette, the whole system can provide us with people with the cognitive psych backgrounds that understand social anthropology, business, etc. My wife and I came here just 3 years ago, so I'm a relative newcomer. And you know, I mentioned that we were very pleasantly surprised with just how much there is in the way of arts and culture. In fact, my wife volunteers at the Calatrava and at the Children's Museum in some of the work she does as a children's book illustrator. And I don't think that we should think about ourselves as, you know, sort of being some second-tier environment. Now, we used to joke when we first got here that because the winters were so long, there had to be something to do. And as a result, this huge cultural foundation, compared to other cities I've lived in, I have to tell you, it exists. And it's pretty rich, and we never lack for something to do. There's always a scene to go check out, whether it's art or music or dance or the MSO. We found it to be completely rich and satisfying. I really do think that the region, Wisconsin, Milwaukee, needs to give itself a pat on the back. Like I said, I've lived in the New York area, I've lived in Missouri, in Rhode Island, in Florida, in North Carolina, the Washington, D.C. area, Ohio, and now I'm here. And I'm here to tell you this is a great city. There's an intangible Milwaukee has that, frankly, in some other more homogenized cities of this size, I haven't found. And it's diverse, it's got edge, and dare I say, it's got a little grit, good grit. Stuff that makes it fun to live here. Never mind that lake is very compelling for a sailor like me.